Okay, thank you. So I think we touched a little bit on the economic side. Now we'd like to invite Dr. Richard Bartlett. Dr. Richard is with International Partnership for Innovative Healthcare Delivery.
Good morning, and thank you very much for the invitation to speak here in Mumbai. It's a pleasure to be back in India and pleasure to speak on this particular panel. My name, as Vishal said, is Richard Bartlett. I'm the Associate Director for the International Partnership for Innovative Healthcare Delivery. We're a very new not-for-profit organization based at Duke University in North Carolina in the USA. We're actually born from a big initiative at the World Economic Forum, which has its India Economic Summit at the same time as now here in Mumbai. What I wanted to do was spend a bit of time talking about why healthcare delivery, why telemedicine was important to the World Economic Forum, and the need for a large initiative there. And then really spend a bit of time talking about what this new organization is trying to achieve, some of the impact that it's trying to have, and really around the need for partnership and having different stakeholders working together. So the World Economic Forum launched this initiative about 3 years ago, and it was looking at some of the broad challenges in healthcare, and specifically around some of the health systems challenges that we see. And I think some of the themes that you'll see on this page here are very much in line with what other panelists have said today, but also other discussions that we've had over the last 2 days. So in developing countries, being able to get basic care to the village, being able to serve the local population is a real challenge. So around access, but also how you can deliver that at a reasonable cost. And then in developed world, how can you provide quality care whilst trying to address some of the financial pressures. And it's often said that this kind of triad of access, quality, and cost, it's one thing to be able to have an impact on two of them, but trying to deliver good care whilst addressing these three challenges at the same time is something that's not often seen in the world. And through the World Economic Forum work, we're able to identify quite a few examples of healthcare delivery where this was actually the case. And if I talk a little bit about the first example on that page, Medical Home in Mexico. Medical Home is one of the entrepreneurs that my organization is currently working with to try and identify further examples outside of Mexico where this model could be scalable. It's essentially a partnership. It's a partnership with Telmex, which is one of the biggest telecommunication companies in Mexico. It's a 50-50 joint venture. About 60 to 70% of calls can be answered over the mobile phone. And it's essentially a $5 a month fee, which is charged straight on top of the mobile phone bill. In addition, Medical has a network of clinics around Mexico and is able to refer patients to these clinics for the 38% that can't be dealt with over the mobile phone. So it's something that is reducing costs for the local population, also saving money at a systems level. It's opening up access, and at the same time, through protocols that have been designed with the Cleveland Clinic, is delivering quality care. And innovation's happening all around the world. We've heard examples in these sessions everywhere from Latin America, back to America, Africa, huge amount going on in India. And it's happening for various reasons. And if you look at a lot of these examples, you can see similar success factors coming out. In the interest of time, I'm not going to go through all of these success factors, but here's some that the work at the World Economic Forum found. And I think the ones that would resonate mostly with this particular audience would be number 2. So it's reinventing a delivery model by using proven technologies disruptively. What that means is, in order to design something that's truly innovative, we were really finding that rather than investing millions and millions of dollars into expensive technology, it was using basic technology. So a mobile phone is something that we were hearing figures of 900 million mobile phone users or figures like that in India. It's being able to harness that technology that already exists in order to drive better quality care. Another good example for telehealth solutions would be standardizing operating procedures. So that's taking a straightforward, standardized approach to the way that care is delivered and being able to really have a dramatic impact on cost that way. So we presented all of this work at the World Economic Forum in Davos about a year and a half ago. And during that session, there was a lot of interest around healthcare delivery, and a lot of the large healthcare companies got quite excited about the work that we were doing. But they said, well, can we turn this into something? Can we really try to understand, as this whole session's about, why a lot of this is happening as a pilot, and that you're not seeing successful models of care like Medical Home in Mexico flourishing in different countries around the world. So we really tried to understand what some of the challenges are in scaling up some of these solutions. And essentially on the right-hand side of this page, you can see the two big needs or opportunities that we found. The first one is really around how you can create an organization out of this. So it's one thing being able to have a successful pilot, have a successful organization, but trying to turn that into something that's truly economically sustainable, makes sense for all of the different stakeholders, and can be grown at scale is a big challenge. The second big challenge that we found is around what I refer to as the valley of death, which is, again, to this theme of this session. It's one thing being able to have a pilot, being able to show that early success, but how do you work with regulators, bring on board financial capital, create a business model around this such that you can really take this to scale, and not just, as with Medical Home, serve 1 million customers in Mexico, but build a model which can serve 10, 20, 30 million people across Latin America. And this is really where my organization tries to support. The International Partnership for Innovative Healthcare Delivery is a very new organization. We launched this year at Davos, and our vision is to support healthcare entrepreneurs and innovators to achieve scale, to replicate successful innovative delivery solutions, both within telemedicine and outside of telehealth, to improve affordable access to quality care. And we do this in various ways. The first way is by convening, networking, and sharing knowledge amongst different entrepreneurs and innovators that are trying to achieve similar things within different geographies. The second is by providing hands-on business mentoring support across all of our different supporters around the world, but also working on projects together. So one of the things we can do is bring together a lot of big companies that are trying to form one-on-one partnerships and build out of silos into something that's truly collaborative. We're going to have an annual Innovator Investor Conference, which is happening next year. We also work with health systems leaders in order to find ways to implement some of these delivery solutions around the world. We truly believe that we've found something which is very unique here. We feel that it really puts entrepreneurialism, innovation at the heart of what we're trying to do, and achieve scale through working with different stakeholders. Currently, we're supported by many large organizations from around the world. We were founded by McKinsey, Duke Medicine, and the World Economic Forum. We have support from various pharmaceutical companies, Cisco, Aetna, the health secretary from Rio de Janeiro as a health system, but also foundations, so the Health Foundation and Robert Wood Johnson Foundation in the US.